Hi, it's Dr. Tim, and I'd like to welcome you to this session on PIP implants. Now, PIP breast implants were manufactured in France by a company called Implant Prosthèses. They supplied around about 13,000 of these implants to Australia between 1999 and 2010, when it was discovered there were some problems in terms of safety and performance of these breast implants, so they were recalled. Now, the TGA, which is the Therapeutic Goods Administration here in Australia, which is our equivalent to the FDA, the Food and Drug Administration in the US, has the following advice, and that is that these breast implants only need removal if they are ruptured or the patient suffers from psychological issues, that is anxiety. Now, just as a matter of a background on PIP implants, you need to understand what a breast implant is all about. You need to think of it a little bit like a balloon. The balloon's made up of silicone rubber, and it's the stuffing that determines whether it's a silicone implant or a saline implant. Now, in the case of PIP implants, these were all silicone gel implants, so we'll stick with that at the moment. The stuffing was silicone gel, which is very similar to Turkish delight consistency, if you like. The problem was that that silicone gel had industrial grade silicone rather than medical grade silicone. And what happens with industrial grade silicone is that the molecules are much tinier, and therefore they can actually leach out through the shell into the surrounding tissues and cause an intense chemical reaction. Now, the other problem with the PIP implants is that the shell itself is made up of a number of layers, and they used a layer also less than normal, therefore making it more susceptible to rupture. So what do you do about the problem if you've got PIP implants? Well, you need to go back to your surgeon who actually did the operation, and if that's not a possibility, then you need to go to your GP, who will send you off to a plastic surgeon. Now, the plastic surgeon should then assess you, looking for signs of potential rupture, which may be pain, swelling, sometimes firmness, hardening, changing the shape of the breast, or lumps and bumps even in the armpit as well as the breast. The problem is that you can have a silent rupture, in other words a rupture but no outwardly visible signs, and therefore this is where you need to be investigated either with an ultrasound or an MRI scan to see what the state of the implant is. If it's ruptured, it needs to come out, and if the patient is very anxious or suffers from other psychological issues regarding this implant, it needs to come out. The current stance is that Medicare will provide rebates for both the consultation and the surgeon's anaesthetist and surgical assistance fees. It will cover also the cost of removing and replacing the implant, but it won't cover the cost of the implant. The other thing is that you may want to look into, if you're in a private health fund, the actual fund itself may cover the breast implant costs as well as the costs of hospital admission and theatre time as well. But you'll need to look into that yourself. So in summary, it suffices to say that PIP implants rupture or leak silicone 2 to 6 times higher than any of the other breast implants. If you put it in another way, at about 10 years, the rupture rate of PIP implants is 15 to 30% compared to around 10% or less for Allergan and Mentor implants, which are the two largest suppliers of breast implants in the world. So I hope this has been of some help to you to make a decision as to what you need to do for those patients who do have PIP implants. I'm Dr. Tim. Thanks for your time. Bye-bye.